Hi, Dave with Align Therapy here. I wanted to talk about 3 secrets, maybe not secrets, but kind of secrets that people don't know about scoliosis that I commonly talk about in our evaluations with new patients. So the first one is that the scoliosis is a 3-dimensional problem. So a lot of times we see in the x-ray that there's a Cobb angle, so the curve that looks like an S. But what we don't realize is there's 2 other dimensions involved in that. So the S-type curve or the C-type curve happens in this plane, so that's one dimension. The second dimension that it happens in is a rotation, so the spine twists. And then the third dimension that it happens in is from the side. If you look, most of the time there's a flattening of the curve that's in the upper back. So that's the first thing, the first secret or the first thing that most people don't know about scoliosis. Number 2, when you look at someone with scoliosis or when they're screening in a pediatrician's office, they have them do what's called an Adams test, where they have them bend forward, touch their toes, and then they look to see if one side of the back is higher than the other. So that's because of the ribs being more prominent, because you have a curve that goes this way, but then you also have a rotation that goes this way. So because of that rotation, the ribs here that are attached to the spine will rotate back on the right side, which creates what we would call a rib hump or a prominence. And then the ribs on the other side rotate forward, and so that creates even more of an imbalance because the ones on the right side are back, the ones on the left are back. Same thing happens in the low back. A curve going to the left rotates to the left. These bones here on the sides of the spine rotate back, and these ones here rotate forward. So the prominence that you see on the back is because of the ribs being more prominent back there like that. So that's the second thing that most people don't know about scoliosis. The third thing is that scoliosis is very treatable. So a lot of times in the US specifically, we've used the wait and see approach to treat scoliosis, which means you are diagnosed and then we wait and see if it gets worse. The conservative way to treat scoliosis is to use the Schroth method or use another scoliosis specific method that helps to reduce the progression of the curve and can actually help reduce the curve itself. There's a lot more research lately on this. So it's very treatable. So if you have it, know that there's something that you can do instead of wait and see. And you can kind of take the reins and do something about the scoliosis rather than just let it happen to you. So those are 3 things that most people don't know about scoliosis. So look at our other videos, subscribe, like our videos, comment, and let us know what other videos you'd like to see.